Hello, everyone. Welcome. My name is Sam Bass. I'm with the Market Intelligence team here at Open Minds. And today, as part of our weekly private roundtable series, we have Open Minds Vice President Richard Lewis and Senior Associate Aaron Pressel. And today we're joined with Bensalem Police Department Director of Public Safety, Fred Herron. And we will be discussing how to build partnerships between provider organizations and police departments. Richard has extensive experience as a behavioral health administrator, business development specialist, and innovator of new service lines. He has been involved with projects focused on healthcare integration, new service lines, and health plan contract development. Aaron is an experienced executive with a demonstrated history of working in the health and human services industry, skilled in nonprofit organizations, crisis intervention, Medicaid, and criminology. She's a strong professional with an MBA focused in marketing, as well as a Master's of Science in Legal Studies. Director Herron has served in law enforcement in the Bensalem Township Police Department in Bucks County, Pennsylvania for 29 years. Currently, he serves as the Director of Public Safety for Bensalem Township. As Director, he is responsible for the management and operation of the police department, as well as the coordination of the township's fire and rescue departments. Now, before we get started, we have a couple of brief housekeeping reminders. While you are muted during today's briefing, we are interested in any questions that you may have. Please feel free to submit those in the question box that should be on the right-hand side of your screen, and we'll have time to answer those at the end. And as a reminder, the recording and PowerPoint from today's briefing will be available tomorrow on the Open Minds website. And with that, I'll leave you with Aaron, Richard, and Fred.
Hi, everybody. How are you? Thanks for joining us today. Can everybody see my screen okay? Can you guys see it?
Mm-hmm.
Okay, so what we're going to do is we're going to go through and have a discussion about building community partnerships and why it's important for police and provider associations to have that communication and that partnership. Give me 1 second. My slideshow isn't moving. Sorry, everybody, I'm having a few technical difficulties here.
I think, Aaron, try if you click. Sometimes.
Oh, there it goes.
Got it. Yeah.
Yeah, it was stuck for some reason. I apologize. Okay. So here's our agenda. The partnerships between behavioral health providers and police departments. Why are they important? You know, why are they being developed now? What is the history of them? Community behavioral health and police department views about these partnerships. Are people happy about these partnerships? Are they open to the partnerships? Are they hesitant to build these partnerships? How do we develop and begin the relationship between behavioral health organizations and police departments? So how do these things start? Why do we start them? What kind of things should we focus on when we're building these kind of relationships? What kind of needs do the communities and police departments have? And what are the difficulties in developing and executing projects like this? Also, where are we going next with the opioid epidemic and kind of, you know, some with the COVID and everything else? Like, what are some of the things that we can put in place to make these partnerships more successful? So the history of how police departments and behavioral health providers responded to challenges in their community has been kind of spotty in the past. So a lot of times police departments and behavioral health providers would kind of respond separately to different situations. But now they're coming together to actually build programs together. Usually, like, maybe there would be a crisis response to something, maybe a mental health team would go out, and if there was something kind of dangerous that was going on, the police department would then respond. but now a lot of times everybody's working together. So Director Herron, what kind of things have you seen about how police departments have done things in the past and how it's changed now?
Sure. So policing 2021 is a lot different than it was not just 30, 40 years ago, but even 10 years ago. We saw a change here in this country during the early mid 90s when Bill Clinton was president of the United States. He vowed to put 100,000 more police on the street and institute an old policing strategy of community policing, and that was born from the 1700s, and it works very well, and we're still doing it now. But one of the things I've noticed, I've been here now for 34 years, is that we were never very good, and we're just changing now in dealing with some of the social issues, mental health, drug addiction, homelessness, aging, children, youth issues we were okay with, but it wasn't something we excelled in. But those other issues just have, the problems have far surpassed our expertise, our capabilities, our avenue, our lane. We're driving out of our lane. Sometimes you hear the expression "stay in your own lane." Well, for law enforcement, sometimes we're driving in the wrong lane, and these things are coming head on at us. Most of the problems we're faced with in law enforcement are a direct relationship and correlation between mental health and addiction. And if we don't change the way we're doing business in law enforcement, not that we'll be putting ourselves out of business, but we're going to continue to see the problems that we're seeing in this country and in policing in 2021. And that's having a long-lasting effect. I was just on a call yesterday with some chiefs from around the Northeast, from Maine to Maryland, and they're having a lot of trouble getting people into this profession. And it's because of a lot of things that we're talking about now, because we're not equipped. And then you see, the incidents that happen in this country, not to debate them, but sometimes of no fault of our own. We're just not equipped and trained to deal with these. So with that said, that's a long answer to, we need to partnership. We know we can't do this together. We are one spoke in a wheel with many spokes. And if all the spokes aren't attached to the wheel, after you get about a quarter of a mile, that wheel is going to collapse. And we can't afford to have that wheel collapse. So all the spokes, law enforcement, criminal justice, education, social service, rehabilitation, addiction specialists, mental health specialists, we need to work together and have a strong wheel that, we can ride on for miles and miles and forever and forever.
Thank you, Director Herron. And also, the programs that exist, so going to the next topic, the programs that exist, they have to be different depending on the different communities, right? So if there's, for example, like a community that's rural or a community that's urban, different programs may exist in those communities because of the needs that they have. There might be difficulty getting transportation, for example, in a rural community, or there might be a bigger, drug problem in a certain community. So some of the examples of some of the programs that exist are like the naloxone partnership, okay? So providing some of the community members with naloxone, teaching them how to use it. A lot of police departments, or most of the police departments now, I believe, are carrying naloxone and being able to provide that should they respond to an overdose. There's also active outreach programs where somebody might go out and follow up on overdoses, mental health programs where people put social workers into their police departments. So there's a lot of different types of avenues that providers and police departments can partner and have it be successful and help the community. So I wanted to talk a little bit about what the responses are to the partnership. There can be a little hesitancy, I think, sometimes to some of the partnering. What has your experience been, Richard and Director Herron, with how the police officers' responses to partnering with behavioral health providers? And also, has there been a difference in the response from police officers of different ranks. For example, like a police chief might be on board with something, but an officer may not be.
So, yeah, I mean, these are great points. So if, for us in law enforcement, there's 900,000 plus police officers in this country. If the chief, whoever he or she is, if they don't take this partnership responsibility, whatever, seriously, then the officers won't follow suit. If you take this partnership responsibly and you push it, and it becomes a way of policing, we don't call it a program or an initiative here. For us, it's a philosophy. It's a way of doing business. Programs and initiatives stop and start. This is unless there's an end to the drug epidemic, and I don't know if that'll happen in my lifetime, or
Right.
a magic pill for mental health, which is not going to happen in my lifetime. Then you have to take these things very seriously. If the chief or the head officer in that particular department pushes these philosophies, the officers will buy in. They pretty much will do what they're told if they see that everybody's taking it seriously. If they think that the upper management, just like in a business, if they think the upper management is just saying it but not taking it seriously, then they'll just go through the motions. So here in Bensalem, all the things, Erin, you had talked about, we're doing. We have the naloxone. Not only do the officers carry naloxone, but we have 24 hours. You can come into the station and get naloxone. You have to watch a 7-minute training video that is in our lobby. We have, earphones you put on, and then we give you naloxone. We have the warm handoff. We have something called the B-Pair, the Bucks County or the Bensalem Police Assisting in Recovery. It was modeled after the Gloucester, Massachusetts project and the Angel program. We kind of adapted it here, where you can come into the police department at 3 o'clock in the morning on a Wednesday in February and say, I need help, and we will get you into an assessment center and into treatment. We have a partnership with Uber. We will get you from here to there, no questions asked. We don't worry about your financial situation. We get you into an assessment. We're not the experts. What you all do, what the people in the recovery world, what they assess, we have to go by that. We just launched in November of 2020 2 co-responders. We have 2 mental health social worker professionals embedded in the police department. They're civilians, but their office is in the police department. They have police radios, and they respond with police, either along the side or right behind police, to mental health and other type of social calls. And that program has been so successful. We saw in one period in 2020 versus 2021 versus 2020, with and without the co-responders, one person that called 911 in 2020 without co-responders called us 34 times. In that same time period in 2021, that person called us 6 times. So that's do the math, that's a 700% reduction in calls for service. If I can multiply that just by 20, which I can, you're going to see freeing up police to do the job in which they were originally hired to do. So those programs, we do assessments through video here. So if someone's in, we can do it. We can link into an assessment center and do the assessment here, and then they can go right from here to the treatment facility if so desired. Our rescue squad, as you heard in the opening, I'm also manage our rescue squad here. We have what's called B Crew, Bensalem Community Resource Unit. So we have a CRS that operates in a SUV with a paramedic to respond to overdoses and do follow-ups. Because people don't realize it's very difficult to take an ambulance out of service to do a follow-up with a family. They really have to get to the next 911 call. They don't have time to do a half-hour follow-up. So we take this special unit and do the follow-ups. And then the list goes on. But you have to be willing to look at other ways outside the box to deal with the problem. 80% of my crime is drug-related. So if we don't deal with the issue, we're just going to be changing the bucket of a dripping faucet. And you know what happens to a dripping faucet? It breaks on Christmas Eve at 3 o'clock in the morning, and you're now paying the plumber $1,000 an hour versus $120 an hour.
That's the truth.
I'll piggyback on what Director Herron's saying. I think if, as police departments and sheriff's departments embrace the kinds of policies and programs and foster the kind of culture that Director Herron's talking about, police officers are very open and welcome to these resources and see them very valuable. They're looking there to Fred's point, they're not mental health professionals. They're looking for folks who can help them with getting folks into treatment and getting assessment and diversion. And in my experience doing multiple forensic programs here in California with state parole, county probation, sheriffs, and police departments across the state, they love it. They love the behavioral health resources that you can bring to them. They don't want to be arresting people and putting them in jail either if they can get them into a treatment setting. And I think those things just have been needed, for many, many years. And I think we're seeing more and more opportunities. I think what Director Herron does there with all of those, that laundry list of programs you do, Fred, I think that's wonderful. And I got to imagine your officers love it.
They do, because, Rich, you hit it right on the nose. The cops want, they took this job for a reason, and there's nothing worse than not being able to help people. And it's out of our wheelhouse. We just don't have the expertise.
Yeah.
Unfortunately, police departments, and I get very upset when I listen to the news. And I can't tell you the last day I might actually put on the news, but we are the only organization in the world, that if you call us at 3 o'clock on a February morning, and you will get us to come out, no questions asked, within 3 to 5 minutes. We don't ask for how you're going to pay the bill. We don't ask any specific questions. You're guaranteed a response. And then people expect a solution. And we don't always have that ability, but you're guaranteed to have us come, and at least somebody's going to be there to try to listen to you and help you. And at 3 o'clock in the morning on a Wednesday, in February, sometimes that's not the easiest thing to do. But there's no other profession in the world that delivers that kind of service. And we're not just plumbers or electricians or carpenters. We're jacks of all trades, master at none in many cases. Mm-hmm. And the problem has far surpassed our ability. But working with the partnership, which is what this is really about, that gives us another tool, another resource to be able to hand off, if you will, the client, the victim, the person that's suffering, to the people that really know what they're doing, and that's you all.
Thank you. And then with the communities, I mean, we've seen too, a lot of stigma around mental health and drug and alcohol. Not in my backyard, people don't want it. What helps communities to become engaged in this process or become a part of this process? Because I know that a lot of programs or, initiatives actually have maybe clergy from the community come through and help. Different family members will come in and help with the program, volunteers. So how do you get that part started?
Yeah, we actually just instituted, that was another program we just instituted at Police Clergy, that not only here for law enforcement, but also respond out on calls with us to deal with people at their times of crisis. This is nothing that you all don't know. You really have to break that stigma. And, if I don't know if I'm going to say this right or not, one of the positives, if you will, with all this is that so many of us are suffering from, addiction in our own families. I am one. Right. Erin, you and I have had these conversations. I had it very close to me and my family. And I think I would like to think that with or without that, I would still be doing the things I'm doing, but I don't know if I can honestly say that. But the fact that it hit my house, it was under my roof, so to speak, I think makes me more like, listen, if it could happen to me and I could get at any time of the day, because of my position, not because anybody cares about Fred Herron, but because of my position, I can get a loved one into treatment, in 5 minutes, because there's so many places that want to help me out. Right. A lot of people. So if I can't fight it, if I can't beat it, and that person, it was my ex-wife, who no longer, after 4 times in in rehab. I couldn't do it anymore. I just couldn't do it anymore. I have a daughter that I had to worry about. But if I couldn't fix the problem with so many resources at my disposal, how can the poor person that doesn't have those kind of resources or connections fix it? You all know, everybody, the 30 plus people that are on today, you know how strong this is. So I think the fact that so many people are affected by this has maybe, increased the awareness and is reducing the stigma. I, for one, I just learned something the other day. We talk about, we're in groups, somebody says, oh, that person's clean. And I never thought of it. Somebody said to me, you're basically saying they were dirty before that. I'm like, wow, I never really thought about that. So I watch my verbiage. I'm still learning. I'm sure I'll make a mistake on this Zoom. So I'm still watching my language, and I'm pretty sensitive to it all. So I think we are getting better at it. I do think we're getting better at it. But I know, like here in my own town in Bucks County, there are a lot of recovery homes, and people don't want them in their community. I get it. 15 guys going in the backyard at the same time to smoke cigarettes, in the summer, and your neighbor has their window open is not pleasant. I get it, but I don't have the answer to that. But I feel like we're getting better, and more people are very aware of the situation. And, it needs to be dealt with on 3 levels. We need to continue to invest money in recovery. We've got a full steam ahead. You can't dip your toes in the recovery water, in the recovery well. You got to jump in, and you got to put your money there. And I'm a strong believer of cutting the source down. We have to cut the source down of the drugs in this country. A large 70 plus, if not 70 to 80%, is coming into our southern borders. That needs to be controlled. And the drugs today are not the drugs of the 70s. The marijuana today is not the marijuana of the 1970s. And we have to educate. That's the cheapest of the 3. But we don't do a good enough job with that. I don't know about the opinions of people on this call, but the legalization, I was on the call I was on yesterday, there are states that are floating the ideas of legalizing all possession of all drugs. Like, are you insane? The statistics show that's not going to work. The medical marijuana, the legalization of marijuana, again, I'm not the professional, but the data that I've read, the people I've talked to, that doesn't help. I don't want to, that's not what this is about, but we have to watch these things very carefully.
And to your point, Fred, I think just from a provider standpoint, because I'm a provider in my career, this is a real good time for providers who are interested in working with law enforcement, whether it's police and sheriffs or parole or probation, to go to those agencies in their communities and find out how can we help, what can we partner with, to your point, because there's such a huge problem right now out there. And I can't imagine any law enforcement agency turning down a resource right now and not being interested in some type of partnership, whether it's funded or unfunded.
Rich, you're exactly right. And if you don't know where to go, don't kill yourself. Go, Pennsylvania. Is everybody from Pennsylvania on here, Aaron?
No, I don't think so.
No. So depending on the state you're in, Pennsylvania has just shy of 1,200 police departments. You can't be making 1,200 calls, and that's not going to happen. But find out where, like, the regional police, like the Bucks County police chiefs, meet once a month. The Southeast chiefs, which makes up multiple counties, meet once a month. Find out who they are and just ask them for 10 minutes. I know you can't give a lot of information out, but I'll give you a little secret. I know this is being taped, so hopefully nobody will use it against me. But police chiefs have an attention span of about 12 minutes. So, and I can say that because I'm one of them. And mine's probably about 8 minutes. So you don't want to throw out, a 45-minute PowerPoint to them. But if you get 10 minutes of their time, then you'll get a one-on-one with them for an hour, hour and a half. That's a little better. But in a group, their attention span's no more than about 12 minutes.
Good advice.
Thank you. So let's talk a little bit about how to develop and sustain a successful partnership between a provider and a police department, or even a provider and another emergency response program. What do we do? I mean, okay, so we have to figure out in the community, what are the needs? What do they need? I mean, is there a huge mental health problem in the community? Is it a college town? And what services are actually available? In some different places, there may only be one provider 30 miles away, depending on if you're in a rural or urban area. So how do we determine what we need? A lot of the ways to do that, you can go in and you can kind of poll the community, find out, look at the statistics, ask the police department, how many overdoses have you responded to? Do we need a naloxone program? Do we need active outreach? Communicate and research. And one of the big things too is funding. I know, Director Herron, when you're talking about all of the programs you had, how do you access that funding? What does it look like? We know that there's some grants out there. Some law enforcement agencies can make room in their budget to maybe hire somebody, but how do you do that? And how do things get paid for?
So, you know, sometimes funding should be the first question, the topic, you know. Funding is obviously a big issue, but for me, you know, especially in Bucks, we have some great partnerships. I know the executive director, I would call her my friend, a personal friend of our single county authority, you know, Diane Rosati here, who's in charge of the Bucks County, executive director for the Bucks County Drug and Alcohol Commission. I got put on the board because I'm friends with Diane, and she asked me if I'd be on the board. I'm like, yeah, I'll be on the board. So get involved. You know, whether it's police chiefs getting involved with you all getting involved with police chiefs. I have many of those folks come and present for 5-6 minutes at a police meeting that we were talking about. And if they're not really saying anything the chiefs are taking home, what they are getting is their name and their face in front of the chiefs, because that they will remember. So even if the substance of the presentation is not going to be retained, their name and their agency and who they are will be retained. Oh, I saw you there, and that brings, just like, you know, human nature, that brings that relationship together. We get involved with our communities that care initiatives here in, again, I'm talking about Pennsylvania, of course, but if you're, you know, anywhere in the nation, Colin Powell, General Powell's group, America's Promise, is alive and well throughout the country. It's still a thriving organization. They might not have money, but they have connections to people that have money. There's a lot of foundations. There's a lot of private entities out there. And this stuff that we're talking about for law enforcement is not expensive. We're not talking about hundreds of thousands of dollars for us. You all have expensive budgets because you're actually doing the work. We're just ambassadors many times, and that's very cheap. You know, one of the things that COVID taught us, one of the good things that come out of COVID is QR codes. Everybody knows how to work a QR code now, because if you went into a restaurant, there were no menus. So we have all our resources. We don't have to print papers in trifolds anymore. They're gone thanks to COVID. And the good thing about QR codes is I could change the information in 10 seconds. So you're constantly updating stuff where how many times a trifold or a business card is outdated by the time you get it printed. So getting that information out there is important. And now in 2021, in a post-COVID world, there's so many more ways of getting information out. Zooms or whatever your method is of doing these meetings. You don't have to travel 3 hours to meet with people anymore. So, you know, we've learned some different ways of getting together. The one thing that you're gonna have to be very sensitive to in dealing with law enforcement is our budget. I'm very lucky here. I have an elected body that's very supportive, but that's not the case across the country. And if police are being cut in other ways, they're not likely to, you know, spend money on overtime or other things in this realm, even though it's not expensive. But for me, cars and bodies and training is always going to be a priority for me. I can never, ever, ever give that up. But there's creative ways, and if you have a good body here, governing body, you're not going to lose those things. But in the days of defunding the police term, which is kind of the stupidest term ever, it's, actually they should have called it refunding or reallocation, whatever. We put money towards our social workers and things of that nature because we're seeing it work, and I don't have pushback from people here. So, Erin, I don't know if that answered your question a little bit.
Yeah, it absolutely does answer my question. Thanks. Yeah, and also with the providers too, when you're providing a lot of these services, when you partner with police, a lot of the services you're providing are billable. So you can get billable hours for doing those services, whether you're out in the community, providing counseling, if they're bringing them to you, doing assessments, all of those things are billable hours for providers. Was there somebody else that was going to say something?
Richard, you had
Oh,
something.
no, I was going to add to what Fred was talking about. I think most providers rely on the RFPs that come out from counties and states and the federal government in the markets that they're in for, whatever funding and new services people are looking for contracts for. But to your point, Erin, many providers have contracts with the county, with the state, under Medicaid, and being able to partner with law enforcement just to get referrals from them to utilize funding they already have for services, case management, linkage to community supports, is another way to kind of leverage that relationship with partnership. And I'll tell you one other thing we're seeing a lot more of these days, and that is the health plans are starting to focus a lot more on, especially the health plans that are serving the Medicaid population. They're starting to focus a lot more on the complex populations, folks that may have a mental health and a drug and alcohol problem. They're starting to fund supportive services in the community, linkage to services. The Aetna Medicaid program in Ohio, for example, they have a in-jail reach-in program where they're going in and reaching out to Aetna members that have Medicaid under their health plan, and they're doing assessment, linking post-jail release to community wraparound services. So I wouldn't rule out the health plans anymore now that they're moving towards that funding for housing in many of the plans, and all of these are things that would benefit the types of populations that law enforcement frequently engages and comes in contact with.
Right. And there's also, I guess the Bureau of Justice Assistance also has something out that they just updated. And it's a police and mental health collaboration toolkit, which is really neat. So I think it was updated very recently. So if you have a chance, go ahead and look at that. It's good information. Tracking data, of course, is going to be very important to show whether a program is successful or not, and also to show the people that are involved whether it's successful or not. I know that a lot of the police departments that I've spoken with, a lot of the officers, maybe they've responded to an overdose or responded to a mental health issue a number of times, and then they don't respond anymore. And some people might think, oh, that person moved out of the area, that person's dead. But a lot of times that person's in recovery. So I think that it's really important to make sure that we talk about, how important recovery is and how people are successful in coming out of substance use disorder and coming out of mental health challenges and getting into recovery, and letting the police officers know, hey, yeah, you responded to this overdose and now this person's been in recovery for a year or two. That's why you haven't seen them. Also, how many individuals were encountered actually by a provider or by law enforcement? It's important to track all of that information, how many individuals have actually entered into treatment. If you're doing a community outreach program and you're going and following up with people that have some challenges, are people actually buying in and coming into treatment and starting a process? And what are the demographics of the folks that you're encountering? What is their gender? What is their race? Where do they come from? Are they transient? You need to know all of these kind of things. I know that some of the police departments that I've dealt with in the past, a lot of the folks came through actually like the transit center. So, you know, you want to look at those things and measure success. Make sure that people know that this is successful, and get the information out into the community and to the police departments and to the providers, and let them know that, you know, this is a successful project. So who's supportive
I had a question for
of these
Fred.
programs?
I just had a quick question
Okay.
for last
Sure.
last slide with regard to tracking data. And Fred, I mean, I think a lot of police departments have that kind of data. You know, they usually do, you know, crime analysis and all those types of things from the law enforcement perspective, but they have data on how many folks they contacted had mental illness or a drug and alcohol, or ended up on an involuntary hold to a psychiatric hospital, or had to be taken to the ED related to, you know, mental health. Is that something that police departments in your neck of the woods would share with a provider to help, not giving names and that type of thing, but in terms of talking together about how do we target this population? And, you know, you probably can pinpoint what part of your county or town where you see most of, you know, those types of contacts and types of services they need. Is that something you'd be willing to share with a provider? And is that something other agencies would be willing to share and collaborate to get something started?
And it's all about those relationships we've talked about. Yeah, we share data all the time. It doesn't do us any good to hold on to it. You know, it's like finding Nemo, mine. It doesn't, you know, you got to share, and because the whole idea is to fix it and get things going. So when we brought on the co-responders, they are actually collecting a lot more data, and the B crew, the Benson Community Resource Unit with the CRS, they are collecting a lot of data on the follow-ups and following up what happened to, you know, we don't have names on the follow-up from your end. We just have person A or person B. We don't have the names or the amount of people that stayed in or dropped out. But we have no problems. At least I don't. I can't speak for every chief in the country, but I have no problems, you know, sharing data. And if the federal data police come to arrest me because I share data, I'll deal with that when it happens.
Yeah. Oh, the sheriff here in LA County just started collecting data on our homeless population. We have a problem, as you know, or probably read about or heard about on the news. But the type of demographic information that they're tracking now has been very helpful for providers and county mental health to be able to hone in on the kinds of services these folks need: male, female, mentally ill, drug addicted. I mean, they've just got all this stuff that law enforcement has never really tracked and published before. The provider world can assist.
We're keeping track of all this stuff now.
Yeah. One of the things, though, we do have to be careful with is a lot of times that police departments can share their information with the provider, but because of confidentiality, the provider is limited to the information they can actually share with the police department. So that's a conversation that has to be had too prior.
And I, you know what, Aaron, you know, I'm glad you brought that up, because I don't have a problem with that. You know, tell me what the rules are and I'll play by them. I don't care. And if I can share data and they can't, you know, when I take my bat and ball and go home, that's childish. So yeah, I'll share what I can, and I respect the HIPAA laws. I respect the rules that you have to play within. Tell me what the rules are. I'll play in those boundaries, and we just want to make it happen. I'm not worried about all that.
Yeah, and most police departments are, you know, there's a lot of information that can go out, and just a lot of the individual information for, you know, we can give numbers and things like that, but we can't give like specific informations a lot of times. So
if there's anybody on
really
here,
been too much of a problem.
If there's any providers on here from Hawaii, I will fly out on Open Minds dime and be happy to help you.
And I will go and carry your bags.
Thank you, Richard. I knew I could count on you, buddy.
I'll hide inside the bag. So
Aaron, you're out, Aaron.
So who's supportive of these projects? You know, we know that there can be a lot of, I know that in Pennsylvania, for example, the Attorney General's office has a program that started the LETI program. There's a lot of big cities that develop LEAD programs. So there's different acronyms for the way that different programs are run. So people are supportive when these things work. And some of the challenges, though, like we talked about, are the funding, the personnel, and the sustainability. For example, the opioid epidemic was talked about a lot. And from what I read actually this morning, it looks like the overdoses are higher now than they have ever been since COVID. So how do we sustain these programs? How do we keep the money getting to these programs? How do we keep people involved and interested? Does anybody have any comments on that?
It's really about, you know, getting that message out there. And it doesn't matter what side of the political spectrum you're on. If you can articulate the problem and a solution, or a solution as best you can, people will buy in, you know, and no matter what side of the coin you're on, most people really want to help, but, you know, it doesn't cost for us, now I'm talking law enforcement, a lot of money to do this stuff. Most of it is what we do every day, just being out there and communicating with people. You all have expenses, you know, and I get that, but for us, the expenses are really minimal. They really are. With the exception of the Beat Crew program, where I'm putting 2 bodies in a car, which we got on a grant to ride around and respond to overdoses, that costs money. But here's the question: what does it cost not to do it? You know, you're robbing Peter to pay Paul. If, you know, for any one moment in Bensalem, just use Bensalem as we border Philadelphia, I have 3 paramedic units up around the clock that operate within Bensalem Township. If I have to take a paramedic unit out of service to try to do a follow-up with an overdose, not that that's not important, but a follow-up is not a 911 call. It's not a life-threatening emergency by definition, if you will. We might argue differently, but, you know, when someone across town is calling in because their mother fell or their father's having a heart attack, that's a 911 emergency, and I've got to put that ambulance, you know, at that location. So now I have this other crew that's able to do follow-up, that maybe this person that's suffering from, you know, opioid addiction or whatever it is, they don't call 911 3 more times. Well, look at the money we're actually saving. That's almost not measurable. So what does it cost not to do these projects? I have some incredible crime reduction numbers here in Bensalem. We have a 42% reduction in burglary. In 2017, it went down another, I think, 36%. And that is for a couple of reasons. Some of the projects we're doing, and this could be one of them. I can't pin it on anyone, but besides my great leadership skills, no, I'm just kidding. We have a lot of some different initiatives that I definitely think to have an impact on our crime numbers. You know, in a crazy way, and I tried, it didn't get very far, and then I kind of got sidetracked to something else because I told you my attention span's 12 minutes. The insurance companies, people that are paying out homeowners and car insurance, they've got Allstate and State Farm, or, you know, ABC insurance company. They got a dog in the fight here. You know, if somebody who's addicted to drugs is not breaking into houses, or is not addicted anymore, is not breaking into houses, they're not paying out premiums, or you know, whatever you call it, you know, claims. So there's a lot of people out there that have a dog in the fight that we don't even bring to the table, and maybe we should. I tried.
That's a good point.
But I didn't. I got sidetracked. I never got back to it, and I'm just, you know, I just got so many balls in the air sometimes. But it's something I definitely, now that I'm talking about it again, it's something I want to, you know, re-engage. In the words of Top Gun, you know, with Maverick, I want to re-engage again. And I quote a lot of movies, although I don't watch much TV. Don't ask me. I used to be a theater major before I became a cop, so maybe that explains a lot of it. if there's any mental health providers on, maybe I can meet with you after it and you can help me diagnose myself. So that's so I don't know what the answer is, but you definitely getting out with folks and that partnerships get you to buy in. And I've got way off track here. Go ahead.
No, but, and I think I mean, you're right on track with everything. And I think a lot of the challenges and barriers are over the past year or two have kind of been removed a little bit, as there's a big movement right now towards getting, non-sworn type of folks working with police officers to engage with mentally ill folks or folks that have drug addiction problems. And I know here in California, there's a number of them. Orange County just launched one where the Beach Police Department, it's when dispatch gets a 911 call, if it's mental health, they're not sending police anymore. They're sending this van with 2 social workers that are not cops, that are not sworn, to be that interface for assessment, and obviously are backed by sworn personnel if they need it. But it's going to be an interesting experiment to see. But I think with that movement for providers, again, now is the time to be looking for those RFPs, whether they're city, county, or state, and engaging law enforcement for how you could participate in some of those types of new initiatives. And they're popping up all over the country now.
Well, and they are, and Rich, we actually have, I was on a call 2 days ago, I think, with, we are trying to expand our co-responder program. So Ben Salem became the model in our county here. And as Aaron said, the Josh Shapiro, our Attorney General, who's very, sometimes I use this word improperly, progressive, but not progressive in a negative way, the way the media uses the word progressive. I think I'm progressive, but in a positive way. And the Letty program and the co-responder program, this is the future of law enforcement. This is the future of policing. In 1987, I think I was making $9 an hour. I was one of only a handful with cops with college degrees. Now we all have college degrees. Over 50% have master's degrees in my department, probably more than 60%. And it's a much more educated field. But I got in an altercation 2 weeks on the job, and I'm like, wait a minute, I'm a college grad. I shouldn't be doing this. And 34 years later, I'm still doing it. But the point is, I wasn't trained for that. I wasn't trained for that encounter. It all ended well, I guess, and I'm still here. But I was not trained for that encounter. 2 weeks on the job by myself, or a couple weeks on the job by myself. So we have definitely changed the way of policing. Policing will continue to evolve. There's no doubt about it. But we also have to, my quick public service announcement to the 20 some odd people or 30 people that are on, you also have to give a moment's pause, and we can't keep getting so radical, against policing, because otherwise you're going to have the movie The Purge, real life. And a lot of these things are happening. We think we have answers and we don't. It's going to create more problems, and we're seeing it now where we can't get cops to take the job anymore. But we do understand there is a need for a change. You will not find too many police chiefs in this country that think all is well, pay no attention to the man behind the curtain. We're going to adapt, and co-responders dealing with recovery is going to be a policing function. It is now, and it will continue to be for a while.
Thank you. So where do we go from here? We've noticed that we've had to pivot a lot because of COVID. So the remote accessibility, we want to make sure that we can provide that. Like Director Heron said, he has a program in the police department where they can actually do video conferencing and get somebody into treatment that way. Expansion of services. One of the things that has started to pop up across the country are crisis centers, or I think that, as Richard called them, like sobering centers, where police have access to them 24/7, and they can bring somebody there rather than to an emergency room or anything else. They can bring them to there. The provider has it, and then the provider can put that person into detox or rehab or some other kind of treatment if they need it. More funding streams. So as this is getting more popular, as we're showing success with everything, we'll see more funding streams come down the pike, I'm sure. You know, we're starting to see, again, helplines. We're starting to see different federal and state and county RFPs for these kinds of things. Offering more services. So we talked a lot about drug and alcohol services, but also mental health services. What are we doing in that capacity? How can we expand? And making data more widely available. So showing, like Director Heron said, like how his crime has gone down. Why did it go down? What kind of programs are actually affecting that? So there's a lot of different things that we can look forward to with this, and we hope that providers will look at this and look at the partnerships and see how we can progress and move forward with it. Are there any last thoughts from anybody until I give it back for questions?
No, I just, you know, I think this is really good. Thank you for allowing me to participate. And, you know, we try to, you know, get the word out there, but reach out to your local folks, find out who they are, get a meeting, have a cup of coffee, and you might find they're doing some of the stuff you don't even know about. Maybe they're doing it without your knowledge. I don't know how that can happen, but we get the change is needed, and we have to work together if we're going to do anything, because nobody can fix it by themselves.
Yeah.
That's right.
I mean, and I think we've said this over and over again, but I'll say it again, just as we're nearing, getting close to the end of our session, and that is, you know, we do a lot, I do a lot of work with health plans and providers here in California, and we hear it over and over again from the health plans that, you know, we don't know who the providers are out there and what they do, what they bring to the table, and what types of solutions they may have to benefit, you know, the health plan membership. And I think that's the same for law enforcement. They don't know that you're out there and that you have a specialty and there's something you can do to solve some of their problems related to, you know, the behavioral health issues, the homeless issues, the drug and alcohol issues. And so again, it's engaging them, it's making them aware that you're there and telling them what you can do. And at the same time, I'll take it one step above, because we're all, you know, funding is always the big issue. Working with your city council, working with your county board of supervisors. Your county board of supervisors have money. They can direct your Department of Mental Health to allocate funds for a specific initiative or project or pilot in your area, because you're saying to the supervisors, I can do this. We can reduce emergency department visits. If we had this, we can reduce you know, reincarceration, we can reduce all of these things. If we had this, and you know, these are the guys that make the decisions around the types of funding that's out there. Working with your state representatives is another way to approach and pitch your solution in your market for, you know, working with law enforcement and county sheriff's agencies, working with the county jail for, you know, post-release programs. All of these are things that you need to take a little bit of initiative and be a little proactive in making people aware that you're there and what you can do.
Thank you. So, Sam?
Hey, we have a couple of questions here.
Okay.
So here's the first one. They said their agency has launched a diversion program in the St. Louis area with the Metro Transit law enforcement. They said initial seed money is there because of relationships. They said their concern and focus is on long-term sustainability to grow and enhance the program. I guess if you could talk about, you know, what are the key aspects for growing and maintaining some of these partnership programs.
An exploration at the Comfort Inn, but I don't know anything about it.
You're going to kill me. I had an incident here. Somebody was talking to me. So was that question for me? I apologize.
Anyone who can answer it, anyone who has an insight as to, you know,
He's
just
probably
growth,
the best person
growth and
to answer.
sustainability.
I couldn't figure out how to mute. There's 100 million applications out here. I have no idea how to mute this one. Just give me the short version of the question. And I'll
Sure. They have a new program that's launched, and it looks like there's some cooperation, participation from various organizations and law enforcement. They said their concern is focus on long-term sustainability and growth to enhance the program. What do you think are key attributes for making that happen?
Yeah, you know, I got that question the other day from someone who had some money for nothing to do with what we're talking about now, for a project for 1 year. I said, although the feds, whenever you're doing federal grants, as you all know, they ask for sustainability. Oh boy, and we're being taped, so I shouldn't say this, but figure out, just put something down, you're going to sustain it. But what if a program works, you'll get, if you got some good stats, you're going to be able to get the money somewhere to sustain the program, because no one's going to throw, you know, a program away that is working because you can't get some money for it. There'll be all kinds of ways. There'll be other grant money to come available. You know, you could, you know, if it's a law enforcement related thing, they could sneak some of it into their general fund. I'm very, I don't know if it's good or bad. I have a very robust federal asset forfeiture program here because of our location in Philadelphia and the Turnpike in New York City. We get a lot of drug money, if you will, and that's a whole topic for another day. But you know, drug dealers' money that's confiscated and forfeited by the United States government. We utilize a lot of that to pay for some of these projects too, but we're not talking a ton of money. But I don't worry about sustainability. I know everybody asks about that, because if the program works and it's that good, I will beat the streets to find the money. If it doesn't work, then we're moving on anyway.
And to that point, data is gold. And Fred mentioned it. You've got to track the data, show the return on investment, you know, how your program, service, intervention, whatever it is, led to some type of cost reduction to law enforcement, to the jail system, to the psychiatric hospital, to the county, whatever it is. And when you can demonstrate that you're saving money somewhere else, it's a cost-effective program, people will listen.
Yeah. I apologize for my interruption.
No, not a problem. And then Aaron, I see a couple of requests here to put the police and mental health toolkit. I don't know if you can find that real quick to put in the chat box. If not, I can get that and send it out to the participant list later.
Yeah, I'm not sure if I can.
Okay, yep, no problem. So we'll get that and we'll send it out. And then looks like we're pushing up against our time. Aaron, I'm sorry, if you could pull up the last couple of slides here.
Yeah, I got it.
We have a couple of announcements. First, want to thank Fred, Richard, and Aaron for their time today. We really appreciate you taking the time to do this. I thought it was very insightful conversation, so we appreciate it. And then Aaron, if you could go to the next slide, please.
Sure.
So this is an announcement for our Management Best Practice Institute that'll be happening next month, August 23rd through 27th in Newport Beach. And so this is the only national event focused on management best practices and must-have competencies that every executive needs to improve the service system for consumers with complex conditions in the next normal. You can sign up at management.openminds.com. And then Aaron, next slide, please. Final announcement. We will be back next week. Please consider joining us. We're going to have another roundtable on how to develop a marketing plan to drive new business and business competitive advantage. This is going to be featuring Open Minds Vice President of Business Development, Emily Corns, and our new Executive Vice President of Marketing Services, John Seymour. And just as a final reminder, the recording and PowerPoint from today's briefing will be available on the Open Minds website tomorrow. And thanks everyone for joining us. We'll see you next week.
Thank you.
Thank you.